I just want to say hello to all my patients out there and send them my best wishes and hope everyone's keeping safe and everyone is looking after themselves and continue to do. And we will get out of this, I'm sure, in not too distant future. I just wanted to say that we are open as normal. Obviously, we have all our procedures in place that we've been doing for almost a year now. And we follow all the strict protocols and procedures, but we are open as normal for business as far as seeing patients. So patients can call up at any time and get appointments. Yes, we're here to help people because there's still, despite the pandemic, as we know, and a lot of my patients are shopkeepers that are still open, supermarkets, still people that are working from home, and these people are still doing things that are causing back problems because, as I've said previously, when they put any pressure on their spine, quite often it will cause problems where the spine can easily end up being compensated if the spine starts to move out of position because of the bending and the lifting, the sitting, the standing. Particularly even ladies at home, mothers that are looking after their children or cooking and cleaning at home, can create problems that end up impinging or irritating nerves that create pain, muscle spasm, and very simply by manipulating and fixing these problems and fixing the functional mechanical causes. These aren't structural problems. These are problems that can be fixed quite easily, and patients are going to get out of pain, and that's what everyone wants to do. They want to lead a happy, healthy life, and we're here to be able to help them. In my profession, I've been practicing nearly 30 years, and similar with Doctor McGowan, that we see a lot of patients, and the vast majority, I mean, out of the hundreds or thousands of patients that we see every year, maybe only 1 or 2 people need surgery. That's it, okay? That's thousands of patients that are going to be okay by my treatment, by Dr. McGowan's treatment, that don't require surgery. So surgery has become something that is much less required in the treatment of back problems. I'm not saying there isn't a need for sometimes, but it is more of a rare occurrence that we do actually need or can even consider surgery. So most of these problems can be rectified by much less invasive, simpler treatments than surgery. Because unfortunately with surgery, the risk is that almost 50% of the patients will be no better or worse after surgery. And there's a lot of extra risks that are associated with surgery, especially in current times with COVID. But even without COVID, there's so many things that could possibly go wrong that are really serious. And these procedures that I do and then Dr. McGowan does have much more lower risk and have much greater benefit in terms of being able to help more people. And let's face it, would you rather have manipulation or massage or, if at worst, an injection versus surgery? You can't compare. Surgery it could be a life-changing thing, and it should only be considered if at all necessary. And we find that there's only a handful, very, very few patients that need it. Now, if someone does need, for example, I'm treating them and I feel they need the injection, I will pass them on to Dr. McGowan. Likewise, if we both feel that the patient needs surgery, we'll suggest that. But that doesn't happen very often. In 30 years of experience, only a handful of patients will ever require surgery. And most of the patients we can help here, between the two of us.
It's very difficult to treat pain problems after an operation. And as Kevin Leiser here has said, about 50% of people are worse after they've had an operation, which is quite a bad success rate. It's really much more sensible to try and get rid of the pain before you have the operation. And most of the time we can do that. Only a small number of patients are referred for surgery. They need it and it's appropriate and we send them down the correct route. But a lot of people could get rid of their problem more easily, have surgery, get a bigger problem, and then wish they never had the surgery in the first place. So surgery is good for the right people, but it's a disaster for some people. So I would encourage people to try the more conservative routes before going for an operation, even if it's recommended. And Dr. Leiser is an expert. I've been working with him for many years now, and the reason I work with him is because he gets very good results. That's very attractive to me because I'm often trying to deal with patients with complex problems, and I need to know I can get a reliable result when they are treated. So we work very well together, and we find that a lot of patients who would otherwise not find a solution to their problem, with the combined efforts from different directions, are really succeeding very well, and they don't need to go down very interventional routes. It's much more convenient for them, much less dangerous for them. And we have to always be very cautious, because people are going to have long-term consequences of anything we do, and we want them to have a good, long, pain-free life, not to be having recurrent problems that keep coming back, or are life-changing because they have got a result which wasn't what they expected. So slow steps in the right direction are safe. Big interventions at the first stage are usually a recipe for disaster unless there's a certain amount of luck involved in it. And I would recommend people always try simple, small steps to see how successful they are before they have a major operation on their back. And I think that's the way that the knowledge has pervaded the medical profession throughout the world. And 20, 30 years ago, people were having lots of operations, and then we learned all the problems that came afterwards. We did the statistics, we looked at the disabilities that happened, and people are much more cautious now and choosy about who goes for surgery, because it cannot be guaranteed to give a great outcome. Apart from surgery, there are lots of causes, or things that lead to surgery. There are lots of causes for back pain. Many of them are very straightforward to deal with. They're to do with alignment, they're to do with muscle tension, they're to do with lifestyle, and they're to do with just general body habitus if people are overweight or have a bad posture. And these are simple things which can be corrected and give people the opportunity to help themselves to improve. And people who help themselves do much better because they join with us, they create a partnership, than people who just wait for us to do everything. And that's also something to tell people, that you've got to want to win this race with us to get the best result. And people do get great results when they do that, and we see this in our experience. The first thing is to make a very accurate diagnosis, okay? And that means speaking to somebody, listening to their pain, examining them and seeing where exactly it is coming from. And there are three things that help me solve pain. I say, where is it coming from? And how is the pain routing into the brain? What pathway is it taking? And the third thing is, what is the nature at the origin? It could be infection, it could be inflammation, it could be damage, and so many things. Usually there is more than one thing happening at the same time in the area, but people only feel one pain. Once I've decided what the sources are and the pathways are, I can interrupt them. And I do this using a mixture of medicines, help from Dr. Leiser with manipulation, and then in some cases I will very carefully split the pain fibers, which carry the pain signals, with an electronic needle, for example, or sometimes we will put injections deep into areas of the body such as the spine, the neck, the shoulder. It depends on whether the pain is in those regions. And usually we can start to see it coming down the stairs. And that's very helpful. Once it's moving in the right direction, we can keep it and steer it. And that's a very good way to clear problems up. And it's very successful, simple, safe, and not excessively expensive.
Dr. McGowan and I have been working together now for nearly 25 years now. So we have established, and because we worked so long together on cases, we co-manage, we manage the patients together, and it's a very unique situation. We're not aware of any other situation in the UK where someone like myself as a chiropractor, who's my experience mid 30 years and similar to Dr. McGowan, have all those years of experience together, seeing all those patients, thousands of patients for so many years, that the patients are going to benefit from two doctors who are top of their game at the moment now, being able to help them with their pain and deal with these problems and keep the problems relatively simple and straightforward, as most problems are pretty straightforward to deal with.